A TANS unit is the most common form of electrotherapy for managing various types of acute or chronic pain. It is one of the oldest modality available for a pain relief, and it works great for a short term if it is used correctly, okay? Before we get into all those nitty-gritty of how it works and how to use it and how to get the most out of it, there are precautions and contraindications to keep in mind. So I have the PDF attached. Make sure you print it out and look at them before buying one or using one. Promise, don't hurt yourself. Be smart. Now, before we proceed, if you don't know me, I am Tippy Patel, a founder of Therapeutic Pain Relief. I combine nervous system retraining along with the therapeutic mobility for a long-lasting pain relief. So the TANS unit relieves the pain through two methods. One is a pain gating and the release of endorphins. In short, it helps you to relieve the pain without the use of or in unison with the pain medications. Now, what is pain gating? So to understand pain gating, we must first understand how pain works. Pain is essentially a warning system in the body that lets your brain know something is wrong. Think of it as the body's car alarm. When something is not right, when you're experiencing pain from an injury, pain signals are sent to the spine, which is sent to the brain. The brain then decodes them and into feeling the pain. Now, the pain gating is a theory that was created by Ronald Melzack and Patrick Wall in early 1960s. And the pain gate theory explains how the nervous system perceives the pain and repeats that perceptions. Especially the theory gates that there are nerve gates at the end of your spine that controls if the pain signals are allowed to pass into the brain to be decoded. And there are two types of nerve fibers we have that carries the pain into the brain. One is the small pain fibers, and then the second one is the large pain fiber. When small pain fibers activity is more abundant than the large fiber activities, the pain gate is open, allowing pain to be transferred to and decoded by the brain. However, the pain gate is closed when the large fiber activity is more robust than the small fiber. This doesn't allow the pain fibers to be sent to the brain, aka no pain. So pain gate theory explains why we rub or shake injuries after they occur. By rubbing or shaking an injury areas, we are creating more large fiber activities which diminishes the small fiber activities and thus reducing the sensations of the pain. So TANS unit activates those large fibers to overpower the small fibers by creating a tingling or massaging sensations close to the pain gate. This tingling and massaging sensation doesn't allow the pain fibers to transit painful feelings to the brain. In short, pain gets temporarily blocked. The second is the endorphin release. When the bombarding of the pain stops to the brain goes, wow, pain is not coming, and a little by little it starts releasing those powerful pain relieving chemicals like endorphin. Now, endorphin helps to reduce the pain by feeling of euphoria, modulations of appetite, release of sex hormones, and enhance immune response. It is one of the feel-good chemicals. That's how it works, my friend. TANS unit causes the body to release endorphins by sending electrical pulses to the body, the same effects as medicinal drugs that we have used without being dependent or dangerous side effects. So your body and mind is smart, intelligence on the planet Earth. You can fool it around for too long. So pretty soon it will realize that what you're doing, and then the pain gate not gonna work. But we can extend that out if you implement these few strategies that I'm gonna show you today. So this is how you're gonna be using a TANS unit. This is an Ultima 5. So one tip for the TANS unit is there are many expensive ones out there, and you don't have to spend tons of money to get the TANS unit. The $15-20 works the same way as a $200, okay? So be mindful of that. It's not the different wire, different electricity or different things like that. Yes, if it's a little bit expensive, it's gonna last you a little longer time, but it doesn't mean it's gonna give you the better pain relief. So keep that in mind. Now, most of the time, whenever you buy the TANS unit, if you get the electrodes that are a little bit discounted, I would buy the electrodes because the electrodes only stick up to 6 to 10 times. So if you have a very oily skin, it's gonna stick less, and if you have a dry skin, it's gonna stick longer. Once it doesn't stick, throw it away because it's not gonna give you the best electricity through the skin. So please throw that away, okay? Another thing is you don't have to use 4 electrodes all the time. You can just use 2 electrodes at a time, okay? Now, one more thing is when you put these electrodes on, I do have the guidelines where those electrode goes depending on the neck pain, back pain, hip pain, shoulder pain, all that stuff. So that's already explained with the pictures in the PDF, so please download that. But here's the general rule of thumb. You always want to make sure there is a 2-finger gap between each electrodes, and you want to make sure they're right on the muscle areas. So never put it on the bone, make sure it's in the nice and muscular area of the body. For example, in the back, never put it right in the center, but you want to put it very next to the spine where you have more muscle mass, okay? So keep those in mind. Next thing is, once you put these electrodes on, is sometimes one more thing is I've seen people making these mistakes and they are in a rush. When they change the electrodes, they don't put the electrodes all the way. There is a little bit of steel left on that side. So make sure you push it all the way. Otherwise, if it's touching your skin, it's going to become a little shocking sight and it doesn't feel good. So be mindful of that. Next thing is, once you turn on the machine, I know I have seen people using this all day long. That's a huge mistake. As I said, your body is an intelligent planet. So you can't fool it around for too long. So if you keep using this all day long, pretty soon you're gonna get potential and it's not gonna work anymore. So I recommend 15 minutes in the morning and 15 minutes at night. Keep about 12-hour gap and use it for a couple weeks and then put it away and then pull it back out again after a couple weeks and then use it again. Don't just use it continuously all the time. This is a great thing to use when you are having the flare up, okay? The other thing is, after you put the 15 minutes timer on, most of the TENS machine will have a few different modes, like a contrast, the modulated, the burst. Doesn't matter what you use. The contrast feels like a little bit of tingling and buzzing. The burst feels like a little vibrating and pulsating. It's like squeezing your muscles. And then the modulator feels easier. So depending on what kind of a pain you're dealing with, you can start one. But every third or fourth day, I want you to change it to a different one, okay? Don't just keep doing it the same thing over and over again, okay? That's again, we don't want the body to get adapted too fast. This is the way you can prolong the use of the TENS machine. All right. Next thing is, when it comes to the intensity of the TENS machine, you want to use it as fast as you can tolerate. So not too much that you are like uncomfortable, or not too little that you're afraid to take it anymore. I would use it as best tolerated, okay? The next thing is, you want to move around when you have a TENS unit. TENS unit is not like you put it on and you put a hot pack on and you sit on a couch. It doesn't work as much. You want to be walking around and doing the things, maybe vacuuming or something like that. As long as you are not touching the water or you're not soaking the device in the water, like anything is water involved, then stay away from it. But you can do the chores around in the yard, in the house, or go for a walk, then it becomes more effective. So those are the tips I have for the TENS unit, and make sure you get the good use out of it.